Hello everyone, it's Dr. Chaz over at PA Men's Healthcare, caring for men's and women's health with precision through hormone optimization. If you don't know me, I'm an osteopathic physician. I'm triple board certified in family medicine, OMT, and primary care sports medicine, and then advanced bioidentical hormone replacement. I have over 20 years of experience caring for men and women with hormone deficiencies using research-driven, evidence-based medicine, and that's huge. Yesterday, Secretary of War Hegseth came out with a video stating that men in the military who are aged 30 years old or older will be screened annually for low testosterone, and if their levels are low, we will optimize their hormone levels. I think that's the best thing that we can be doing for members of the military. Unfortunately, many members of society and many physicians came online and made posts about how this is a bad idea. It's against evidence-based medicine. It's against society recommendations. Here's what I'm going to say about your society recommendations. I think they're garbage, honestly. After 20 years of treating men and women with hormones, all the men and women that have lost their lives because doctors are afraid to treat with hormones, we have solid evidence showing that hormones decrease the risk of all-cause morbidity and mortality when you treat men with low testosterone with testosterone replacement therapy. Why aren't we checking them? Why do we don't want them to get better or don't want them to be healthier? Why wouldn't we check them, symptomatic or not? So I think saying that it's against evidence-based medicine to screen a man for low testosterone if they don't have symptoms, I think that's garbage. I think that's a bad policy. I think that's a bad policy, and I think those are bad guidelines, and I think they should be changed and updated and reflect current evidence-based medicine. So why is that important? Because men with low testosterone have an increased risk of dying from all-cause morbidity and mortality. When you replace their low testosterone with testosterone replacement therapy, you decrease their risk of dying from all causes, especially if you get their levels up to the top quintile. And that's a game changer for men. Men will have improved endurance, they'll have improved cognition, decreased risk of injury, decreased risk of fracture, decreased risk of diabetes, decreased risk of cardiovascular disease, decreased risk of prostate cancer. This is huge. This is something dramatic that we should be doing, not just for men in the military, but for all Americans aged 30 and over, men and women, because low testosterone causes significant health issues. And if they have low testosterone, we need to treat it. Whether it's symptomatic or not, we should be doing it. And there's numerous studies that support the benefits of using testosterone replacement therapy in men with low testosterone. I don't care if they're symptomatic or not. Let's treat them. Let's make them better. Let's make them healthier. Our warriors, our men in the military, deserve everything we can to keep them healthy and to make sure they come home. That's what we should be doing, not talking about guidelines that are outdated and that don't recommend treating someone, if they didn't have symptoms for low testosterone, if their levels show they have low testosterone. Treat them. Let's get them healthier. Let's make them get better, because the benefits of testosterone replacement therapy outweigh any potential risk. Now, looking online and reading some of the comments people were posting, there were some people that said that if we give men testosterone in the military, they're going to have roid rage. Well, that's also not true. Contrary to what AI says when you Google what roid rage is, contrary to what's in all the movies and on TV shows, when you give someone testosterone, you want to do it a certain way. You do not want to inject every 2 weeks. You do not want to inject once a month, and you probably don't want to inject once a week. You want to do it at least twice a week, 3 times a week, or 7 days a week. The more frequently you inject it in some patients, the better that steady state level will be. But no one should be injecting every 2 weeks. No one should be injecting every month. And probably no one should be injecting weekly. That's bad medicine. You're going to make your patients sick, and they're not going to want to use testosterone because they're going to feel bad. When you inject testosterone, your testosterone levels go up. If you wait too long to inject again before your next dose, the levels drop and you feel like crap. When you keep doing that, and if you get a good steady state and you drop really low, you're going to have roid rage. It's the low levels of testosterone after being therapeutic or having a super physiological level that made you feel good. Once that level drops, that's what causes roid rage. It's not a high level. It's a high level then dropping to a low level, because we want to maintain steady state. And a lot of doctors don't understand that, unfortunately, and they cause roid rage. Some other people said that there's a high risk of domestic violence in men in the military when they come home to their spouses. What I say is they're doing this most likely because they have low testosterone levels. Men with low testosterone levels have mood disorders, they're irritable, they want to fight, they have depression, and there's a high risk of suicide in these men. I think if we keep these men, when they're on deployment, all year at appropriate, good, optimal levels, not normal levels, but optimal levels, which makes them feel the best all year, that when they come home from deployment, I think they will adjust better, and there will be significantly less domestic violence, and there may even be less suicide, and that's huge. If we can decrease the risk of an active member of the military or a vet from killing themselves by giving them testosterone, that's a game changer. And I think that's what we should be doing. But no one's looking into it. I've seen it. I've seen patients that benefit from it. There's studies that show, randomized controlled trials that show that when you give men testosterone for mood disorders and depression, they actually do better than if you give them an SSRI or an SNRI. That's huge. Why aren't we doing this? Why haven't we doing it sooner? There are also some patients that said the old standby, testosterone causes prostate cancer, testosterone causes heart disease, and none of that's true. Men with low testosterone, if you replace their testosterone levels and you get them to optimal levels, it actually decreases the risk of dying from all-cause morbidity and mortality, decreases the risk of prostate cancer, decreases the risk of heart attacks and strokes. This is what we should be doing. We shouldn't be worrying about, are we testing someone and getting a false positive and then we got to test them again? Test them. If you're concerned that it's a false positive low level, then repeat the test. Repeat it in 2 weeks. If it's still low, treat them, symptoms or not. And then men that have normal levels that are low normal, that have symptoms and signs of low testosterone, treat them for low testosterone. So here's what we should be doing and understanding. Dr. Abraham Morgan Taylor said that there is no testosterone level that reliably dictates when a man will be symptomatic of low testosterone. And that's huge because you can have normal levels of testosterone that are in the normal range, but you actually have signs and symptoms of low testosterone. Treat them with testosterone, optimize your levels, and the patients get better. They feel better. They do better. So I think we need to be treating men for optimal levels, not just normal levels, so that they do better, especially our members of the military. We need our members of the military to be elite war fighters so they can come home. And our enemies are using hormones. Our allies are using hormones. We need to be doing it too. God bless America. Keep our men in the military safe. If you have any questions, reach out to me. Talk to you soon.